Hello, everyone, and welcome to Toolkit Talks Joy in Work Webinar 2. My name is Jennifer Smith, and I'm an outreach professional at CoCares under CDPHE. CoCares stands for the Colorado Alliance for Resilient and Equitable Systems, serving the healthcare and public health workforce. So the Joy in Work Toolkit was originally created by the National Association of County and City Health Officials. They used the Institute for Healthcare Improvements framework for improving joy in work to create this toolkit. So today we're on webinar 2, and we're going to be talking a little bit about psychological safety and how to form your team before starting on step 1 of the actual toolkit. So this is just a kind of preparation stage to get you ready for implementing the Joy in Work toolkit. So as you can see here, this is the Institute for Healthcare Improvements Joy in Work steps. They do build on each other. So you're going to start at the bottom with step 1, asking staff what matters to you. Step 2 is identifying unique impediments to joy in work in the local context. So finding those barriers. You're going to commit to a systems approach to making joy in work a shared responsibility at all levels of the organization is step 3. And we're going to be talking a little bit about that today and implementing your team. Number 4, or step 4, is to use improvement science to test the approaches to improving joy in work in your organization. So those are the 4 steps that are in the joy in work. And today we're kind of doing a prepare and getting ready to understand some of the concepts and some of the things that you should have kind of a little bit of an understanding before you get started in the process. So welcome to the Joy in Work Toolkit. So today we're getting ready and preparing. So we want to make sure that you're having meaningful conversations. And so what does that mean, right? Leaders are often not ready to have potentially uncomfortable conversations with colleagues. And many put off these important dialogues because of 2 primary concerns. Number 1 is, what if colleagues ask for things I can't do? So I think the biggest thing here is, understanding that it's part of the listening, right? So part of that active listening, making sure that you're understanding what people are asking and keeping track of it. So even if you can't do something, you're letting them know that I will do my best. I will look into it. I won't forget that you asked this and that these are your concerns. And then you get back to them later, right? Making sure that you always follow up with them and say, remember, like we had this conversation, I checked into it, and this is why that we can't really do anything about that, at least right now. And then number 2 is, how am I going to fix all the things they identify? So it may feel like a long list. It may feel like just a ton of things are coming out in these conversations. But again, this is why you're forming a team to help you have these conversations and understanding you can't do it all alone. And then just making sure that you keep track of what they're saying. Record meetings, take meeting notes, and make sure to always follow up. Again, with the meaningful conversations, you don't have to fix everything now. The first step is really about the conversation and listening to understand what matters. Leaders, supervisors, and managers fear an avalanche of issues falling on them that they may not be able to address effectively. And then you should recognize this is a different approach than the usual, I tell you what isn't working and you fix it approach. So again, you don't have to fix it all now. It's really about having the conversation and really listening and then understanding what matters. So using those active listening skills, recording everything and making sure you're just having the conversation, opening that up. And then an avalanche of issues. Yes, there may be a lot of issues and some of them may be similar, some may not, but just making sure that you're remembering again what they're saying and you're always making a point to talk about these concerns and to bring them up later, even if it's taking a while. It's not a one and done situation. It's going to be a process. And then, it's not a usual process of, telling people what isn't working and you fix it approach. It's really working as a team. So it's a completely different ballgame, and it's not going to happen immediately when you're working with a team. It's going to take several conversations to even just start kind of organizing these ideas. And then, so this is how you're going to help form your team. So you want to train staff at multiple levels to apply these conversations, right? It's not all up to you. It's not one person, it's everybody. And as a leader, part of your role is guiding the work to improve joy, satisfaction, and engagement. There are things to consider when starting this process. So, understanding you cannot do everything on your own, it really will take a team effort. And others may be better suited to take on certain tasks. Knowing your team, knowing their skills, their strengths, your skills, your strengths, and then your weaknesses as well, you'll be able to find your team and help facilitate that discussion on finding that team. And supervisors and managers at all levels are able to affect change. So, in most organizations, there are many different levels of leaders, leads, managers, supervisors, administrators, all different kinds of people that are able to help you and affect this change. So, this here is IHI's examples of effective teams. So, effective teams include members representing three different kinds of expertise within the organization. You have a system leadership, you have technical expertise, and you have day to day leadership. And they do recommend that all three areas be represented in order to drive improvement successfully. So, through their, data and through their, improvement and testing, they found that all three areas really should be represented to make sure that this works. So, in your organization, you're going to have to do a lot of just exploring to see how many people you have and who these people are that can help you. So, number one is the clinical leader. This is someone with enough authority in the organization to test and implement a change that has been suggested and address issues that arise. Then you have a technical expertise, someone who knows the subject intimately and who understands the processes of care. And then your day-to-day leadership, which is a person who's a day-to-day leader and the project's driver. So this is kind of the one who's driving the project, assuring that tests are implemented and overseeing data collection. So again, you're going to have that clinical leader who's really good at being able to organize testing, maybe it's a nurse manager or something like that. They can go through and start implementing tests. They can help with address any issues that arrive or tell you like this didn't work, but this did. Then you have the technical person who just understands the processes, right? And knows if those changes can be made right off the bat. They may be able to say, no, that can't work and this is why, or, we could try this instead. And then the day-to-day leader is kind of that overall person just really driving the project, making sure that the tests that are, spoken about are implemented, and then making sure you get some data collection when you're trying to make sure that everything's working correctly. And then they also say one good person to have is a sponsor. So the sponsor is the executive authority who can work with other areas of the organization. They can serve as a link to senior management and the strategic aims of the organization. They can provide resources and overcome barriers on behalf of the team, as well as accountability for the team members. So this could be, depending on the size of your organization, this could be someone who, really isn't there for the daily work and, even your meetings about this, but someone can inform them about what's going on, and then they can also work with other areas of the organization. So, and they're kind of that link to upper management as well. So this could be an administrator, this could be even a CEO or something like that, really at the top. But, I think just finding, who could be that can help overcome any kind of barriers. Okay, so since we've talked about forming the team, and again, that will be discussed even more in the later steps of the toolkit. So don't worry that these are just kind of previews of everything right now, and they will be discussed in, a little bit deeper later on. But we want to just give a nice preview of these things. So we've talked about how to kind of get an idea of who would be on that team to help implement joy in work. Now we're going to talk about psychological safety at work, which is essential for team participation and engagement. And you're really not going to get anywhere with implementing changes unless people feel safe, they feel they have trust, and they feel understood. So these are some things to just kind of think about when talking about implementing the joy in work. You want to make sure psychological safety is there before you start that process. So listen and act on lived experience to understand and address concerns to the extent organizations and leaders are able. So what they do say to do is conduct frequent, brief well-being huddles. These can be weekly to learn about current pressing issues. When you're listening and discussing things, make sure you are listening and not interrupting. Learn what is going well and not just on problems. So we want to focus on the bright spots, the good things, the positive, so that we can make sure to implement those in other areas. Make sure to focus on those and say what else can we do that's like this, that is going really well in these different areas. You're not just going to focus on problems. I mean, of course, they're going to come up and you're going to have to fix issues, but also what are the good things that we can add on to and do more of. And recognize that frustration and anger are normal reactions to change, not a personal attack. So, just because people are maybe a little resistant or a little frustrated or maybe even angry, change isn't easy. Processes and things that have been in place are, have been there for a long time. And so any kind of change just can cause a little bit of stress. So just know that it's not a personal attack on you. It could just be the change overall. And I think once you start having these conversations more and more, and things are getting better and things are improving, I think people will kind of calm down and they'll realize that these are good changes that were needed. And they say to don't do these things for psychological safety. So don't assume because concerns may vary by person. So you may have a completely different view than somebody else. We all take different experiences and things differently. So just make sure that you understand that what one person is saying to you, another person might view completely different. So make sure you're talking to each person individually. Don't ignore strengths and bright spots. Again, you want to make sure that you're focusing on those and always giving kudos to those areas that you're doing really well and the people that are working really well and working well together. And don't underestimate the learning required and time it takes to address pandemic and non-pandemic efforts. So really, it's going to be a big learning process. This is not, again, a simple task of bringing joy in work. This is a process, and it's going to take a lot of time and a lot of effort to address all these issues, to fix things, to just the conversations itself, even without implementation, are just going to take a long time. So I think just understanding that and having a little patience. And then don't promise to fix an issue when you may not be able to. So always hear people and let them say, and always, again, remember to follow up. Don't forget what people are saying, but don't promise to fix it if you don't know if you're going to be able to. Just, let them know it's on the list and we are looking into everything that you have said today. And then steps to try. So these are some good steps to try to bring psychological safety to the workplace or improve it. So you're going to ask, what concerns do you have for the community, yourself, or the team? So the community can be, the patients, it could be the entire organization. It can be, ask what they need for themselves or the team. So always ask those questions of people. And then ensure you understand by confirming, here's what I hear you saying. Do I have that right? Repeating back to people what you think that they have said and your understanding of it, and making sure that is what they meant by it. Because sometimes, we can hear something, but it's not exactly in the context that somebody really meant it. So make sure you're really understanding what people are saying. This is why I always recommend recording meetings, because even note-taking can be just sometimes bias. So make sure that you're really hearing what they're saying. And then always ask, what do we still need to learn? So this is an ongoing process, and you'll always be constantly learning. You always need to practice that curiosity and understanding what else can we do? What else more can we, do we need to learn? And then ask, what can we do together that would help right now? There may be some simple things and some really easy changes that could be implemented and made that would really just help right now and give people maybe just a little bit of something, maybe that little bright spot they need to, again, build that psychological safety and go, you know what, this is going to be a good thing. I already see these changes and these things that are going well. So focus on something that you can do right now as well. And then ask, what can we stop doing? What makes no sense to continue? A lot of times there's a lot of little processes and things that maybe came around for some reason or another, but really you don't need to keep doing them now. And it's just kind of causing more work or more confusion or more stress. So what can you just stop right now? What do we not need to continue doing? Maybe there were some things during the pandemic that you can just stop doing right now, and it will make people just a little less stressed and make things a little easier. So to sustain joy in work for psychological safety, you're going to need to continue well-being huddles to learn about current pressing issues for staff and focus on what matters most to teams. This is not a one and done. Again, this is a constant work to really just sustain joy in work. You don't want to do it once and then forget about it. You can try different small tests to identify the huddle time, agenda, and facilitation structure that works for each group. You can empathize with staff when they encounter change and invite them to co-design it. So make sure, again, change is hard. When you co-design something and you're a part of that change, it makes it easier because you've had your input, you've, been heard. So when changes happen, it makes it a little bit easier. And then empathize with them because even just small changes can really affect people and just be hard. So make sure you're understanding in that. And then partner with staff in decisions that affect them. So that's kind of the whole joy in work process, is really partnering with staff, making it a team decision, make sure that they're understanding every part of a change and a decision, that it's not just being made for them. It's really going, we hear you, and maybe not everyone's going to agree, but if most people understand why this change or this decision has been made, people will, they'll come around to it, and understand that it is a team decision. So it can't just be one person holding things up as well. And so that's it for today. Just kind of brief discussion on how to kind of look and form your team, who those people are, who you need to look for, getting to know the skills and strengths of your team and of yourself so that you know how to delegate and give out these roles to the people on the team. And then psychological safety, again, no change and no team process is going to work without building that trust and having people feel psychologically safe. It's just not going to work without that. So make sure to just look up more information about those things. You can always go to the Institute for Healthcare Improvement's website. They have a lot of information on the framework there if you're curious for more information. And they have a lot of YouTube videos as well on the processes and just a lot of little information that is useful. If you need to contact us at the CoCares team, you can email us at cdphe_healthcareworker support@state.co.us. You can click the QR code there for our website, which is co-cares.org. And so we appreciate you watching our video, and we hope that you join us for the next one, where we start the first step of joy in work, which is starting asking the question of what matters to you in the workplace. And we appreciate you watching today. Thank you so much.